need be, I can relinquish directorship to someone else and focus on service delivery.
Okay.
Chair,
okay. Yeah.
he has given two answers.
Yes.
One, he can either relinquish or there is no conflict of interest. Which one are you taking if you are given this position?
There would be no conflict of interest because it is not a service, it's a business. It's an autonomous business wide that runs without my input, my direct input.
Thank you. Yes, Mheshimiwa Kapkea.
Thank you so much, Chair. Daktari, congratulations first. And yes, I want to know, in this Department of Health, we have 2 chief officers. You applied for clinical services. And there is also the other one for preventive and promotion. You are a medical officer. And some of us, we are not medical officers. You can make us know the difference between the two so that you don't have any conflict between you and your counterpart or your colleague if given this position. So kindly make us understand what it entails, what clinical services entails, and what preventive and promotion services entails. And secondly, a department depends on the chief officer. You are the one who really does day-to-day operations of a department. And you've worked in a private sector and maybe previously in a public in Kakamega and the other ones. Now you are coming to another department where you are supposed to balance, politics, there's also public service and national government policies. So kindly tell us, how are you going to balance those? That you are now coming to a public and you've worked in a private for a very long time. Thank you.
Thank you, Honorable Member. Let me recognize the presence of our legal officer, Madam Michelle, and Honorable Member from Kapsaos, Isaac Samoe. Welcome. Proceed, our nominee.
Thank you, Honorable Chair. Thank you for the questions, Honorable Kapkea. The difference between we have 2 chief officers in the Department of Health, preventive and promotive, and clinical services. Preventive and promotive will mainly deal with the prevention of disease and the deterring of disease, for example, and disease control. These are areas like malaria, TB, HIV and AIDS, prevention of HIV and AIDS, prevention of COVID, sanitation, waste disposal. That falls under preventive and promotive. For curative, there we focus on treatment, where you are directly treating the patient. This is drug supplies, surgical services, mental health. Those are just a few examples of what is under the Department of Clinical Services. Then, how would I balance politics and service delivery? Again, I will consult, because different challenges come with different scenarios and different situations. So I will consult my peers and also consult the legal
Point of
framework.
order.
Yes, please.
We don't have a PS in county government.
Peers.
Oh, okay.
Peers,
Okay.
yes,
I thought you
yes.
said PS. Thank you.
Peers. And also consult the legal departments that would advise. Yes. Thank you.
Okay, thank you. On the same note, Mr. Wangwe, you say you have passion in working in Uasin Gishu County as a chief officer.
Yes.
And what the question Mr. Kapke have just asked about the two chief officers. And now you are in clinical, where you meet with that public daily in terms of health services or medication, not even health services, medication. How many health facilities do we have in Uasin Gishu County? Do you know how many do we have? How many are primary health services? How many are health centers? And how many dispensaries do we have in Uasin Gishu County?
Thank you very much, Honorable Chair.
Before you proceed, I want to give Honorable Nathan Malamoj to add, at least to be 3.
Thank you, Chair. First, I want to congratulate you, Dr. Wangwe, for your appointment. My first question is, what, from your knowledge or from your research, what are the challenges facing the health sector in Uasin Gishu County? And if given this chance, what will you do to address these challenges? Number 2, we have seen the mushrooming of private sector in all over the county, even at the doorsteps of health facilities of the Uasin Gishu government. And now that you are running multi-million company private sector, what will you do to ensure that our Uasin Gishu residents get proper health from our public health facilities rather than going to the private sector? Thank you.
Thank you, Madam Moch. I also want to give opportunity to our Leader of Majority, Mr. Sang.
Thank you, Chair. Daktari, good morning. I want to join my colleagues in congratulating you for the nomination to this position that you applied for. We, as a committee, want to know, my colleagues have asked if you have considered inquiring into the problems facing the health sector in the county. My first question is a personal one. What motivated you to pursue dentistry as opposed to the other medical disciplines? Number 2, you have said you worked in Kakamega County and rose to the position of the head of department. But you are a son of Uasin Gishu. Why Kakamega? Why did you not consider working in Uasin Gishu? And what gives us assurance that you will give your all to Uasin Gishu and not Kakamega? The other question is, in your line of duty, where you have worked previously, or when you are pursuing your studies, have you ever done any studies, research in Uasin Gishu? And if so, have you shared any findings to the Department of Health in Uasin Gishu? The last one is, you have talked of improving health services in Uasin Gishu, and one of the steps that you said is to improve the motivation of our employees. Daktari, the word motivation has been used widely. Many people who have come here seeking for jobs have said they will motivate our staff, especially in this department. To me and to this committee, that is so general. We want to know the specific steps that you're going to do in order to motivate our staff, because therein is a problem in health. The issues of HR, the issues of human resources in health is really a problem. So what do you plan to do in as far as motivating our staff? Thank you, Chair.
Yes, welcome, Dr. Wangwe, to answer those questions.
Okay, thank you very much, Honorable Chair and Honorable members. The first question was about the health facilities. We have approximately, I'm saying approximately because what research I've done, because some are partially operational. There are 138 facilities covered by approximately 2,300 healthcare staff. About how many are dispensaries and level 1 and 2, I am not sure. I haven't done the statistics. Then challenges facing healthcare. Now, I will talk about challenges facing healthcare, not only in Uasin Gishu, but all across the country. These are also challenges in private sector. The biggest challenge, of course, is human resource, where either there is understaffing or low training, or motivation or disciplinary issues. Then, healthcare financing. Healthcare is a consumer. So at any point you expect that healthcare consumes, it is in rare cases that healthcare generates income. Then another challenge is that comes in line, combines both healthcare financing and human resource, is patient records and follow-up. Services are always affected when patient records are poor. You cannot have proper follow-up. So how to mitigate this is to maybe digitize the patient follow-up process and have sustainable human resource, because healthcare is personalized. That is where the private sector beats the public sector. So we have to find a way of personalizing the healthcare, so that when you go to seek treatment in a public facility, yes, you are going to the public facility, but to an individual, just as you go to the private facility. Then the other question about competing interests with private facilities. I would look at it in a positive way, that private facilities are good because first, they help in reducing the healthcare burden, because there are services that they are yet to be given by a government facility because of one reason or another. So we would again use this as a means of public-private partnership, where we can ensure that we work together, because the main agenda is service delivery to Mwananchi, healthcare delivery to Mwananchi, and have a clear-cut policies that will not jeopardize service delivery and mix the two. Then the other question was what I would do to ensure better healthcare. We would increase the partnerships, advise on policy. I would structure patient records and motivate which I will expound later, motivation of staff, and also equipping of hospitals through equipping the necessary items, because in many areas there are challenges where advising procurement, there is miscommunication. So you get that the resources are not properly utilized. Yes, equipment is bought, but there has not been a needs assessment for those equipment. So we are going to consult, of course, through the honorable members of parliament and get the needs of the community so that this is passed across, and also members of county assembly, and the needs also of the departments, and all stakeholders be involved in this process so that healthcare is better. Then the reason why I decided to become a dentist is I remember I made the decision when I was in class 7 while I was being treated just in this town. The whole scenario of being a dentist excited me. I wanted to become a doctor, but I had not zeroed on what exactly, and then I thought that dentistry was simpler than the general body. I thought it was just about teeth, but I came to realize that it is still the whole body. That is the reason why I found myself in dentistry. Then about working in Kakamega, and I reside in Wasingishu. After internship, some time back, the government used to post anywhere. So it was random selection, just the same way a class 8 can be posted to any high school. So the Ministry of Health placed us in centers. And again, you are posted, because there are not so many dental facilities in the country, you are posted where there is a dental facility. Yes, I have done research while I was a student. It's in my documents about disimpactions, but that I did that research in Vihiga County. It's in my document. Then, for motivation of staff, there are very many ways where you can motivate staff through trainings, increasing their, which will increase their efficiency. Then also doing a needs assessment, because or a job satisfaction survey, because some officers may, this is just an example, may be in areas where they are not effective, so they may be misplaced. That can be a reason for demotivation. Addressing their needs, especially workplace needs, something like a desk or lack of lighting. The simple things can affect service delivery. That is what I mean when I talk about motivation of staff. And also maybe being judicious in terms of deployment and posting. Thank you very much, Honorable
Thank you.
Chair.
There is a question you didn't answer from Kapkea. He did ask about how will you balance, did you ask that? How will you balance politics and public service? Kapkea, is that what you asked? And I didn't get him well.
Okay. Thank you very much, Honorable Chair. I will balance public service and politics through, again, if I encounter any challenge, through consultation, because the process is both intertwined between service delivery and politics. So I will look for advice and consult my seniors, my colleagues and my peers on how to deal with each scenario as it comes, and also follow the law. Yes.
Kapseret, Mr. Kebene.
Thank you, Chair. Following up on Mheshimiwa Kapkea question, Daktari, as a chief officer, A chief officer is an accounting and authorizing person in the department. What strategy plans do you have for staff in your department in terms of motivation and retention of the best employees, considering health, what do you call it? Considering the health staff, most of them are we usually get a lot of, is it brain what?
Brain drain.
Yeah, brain drain. Yes. The best staff, most of the time, are being poached outside the country. And for outside the county and outside the country. So the best staff we're going to have in this county, how are we going to retain them?
Mheshimiwa from Kapseret, welcome. Kapseret.
Okay, thank you, Chair. Dr. Wangwe, as you know, health is fully devolved. And previously in the past regime, we had so many challenges as far as health is concerned. So I have a few questions. If given this position, you will basically be overall team leader, managing the department with your elaborate CV. Tell us how much you know about the public service management. 2, as a CEO, how do you intend to deal with senior officers in your department to bring more services to our people and efficient? As you know, county government of Wasingishu, most private investors have invested so much, knowing the weakness of the county government in dealing with health department. So for us to make sure that we get the Nguso Kumi successful as a manifesto of our CEO. Thank you.
Okay, Mheshimiwa Sawe from Kamagut.
Daktari, there is a prevalence that our doctors and clinicians here in Wasingishu are looking for greener pastures outside the country. And what is in the public domain is there are no promotion. There've been no promotion for the last 15 or 10 years. What will you do to address the issue? That's 1. 2, recently we were going through visiting health centers, and we found out that one health center had only 1 staff, manning, treating, attending to patients, and in such occasion and such cases, how will you do? Thank you.
Welcome.
Thank you very much, Chair and honorable members. So, being the authorizing and accounting officer of the department, the question focused more on the authorizing officer and retention of staff. Retention of staff may not really be in terms of monetary reward, and how again would motivate staff. This motivation can be recognition. that can create competition, and a staff member can desire to work harder so that they are recognized. Recognition can be through recommendation. This person can be motivated and also know that they will use this, if it's a letter, anywhere else, and even when seeking for promotion, which again is a way that will deal with staff. Then employee retention, just as I can repeat, training and job satisfaction can address the issue of employee retention, because people would want to grow and move from where they are today, where they were yesterday, to where they are today. Individuals would like to see a difference. Another way is having an open office approach, where all staff will be able to address their issues either in a structured manner, or have a complaints committee, or have a committee to address their welfare needs. Welfare can also be another area where we can address and have staff retention. A question on the past regime. I'm not so conversant about what happened in the past regime. I did not follow up closely. Then in public service management, we talk about managing of resources, managing of human resource. Most of these things are encompassed in the County Integrated Development Plan. This is a 5-year plan that is broken down into an annual work plan. So this will assist in budgeting, and most of the programs follow the plan. So we cannot go outside this plan. Then how would I manage senior officers to perform? Again, we will go back to motivation. Then we can introduce things like performance contracting, where we assess periodically these members of staff, and they are accountable, and ensure that if we begin the performance contracting, we are consistent. Because in most cases, staff know that those things are never assessed. And then also having an annual work plan broken down into departmental work plans. Then Honorable Member Sawe asked about being in the public domain that doctors are looking for greener pastures. I have heard about that, and I'm still finding out why they are looking for greener pastures. I haven't found the reason yet. But again, we go to the plan and budget for issues like promotion, because they have to be budgeted for, because with promotion comes remuneration. So this is through budgeting for remuneration, managing the resources judiciously so that there is enough for promotion. Okay. Then in areas where there are a station where there's only one healthcare staff managing a facility alone. In healthcare, we would focus mainly on delivery of the service, not the infrastructure. I have this opinion that a service can be delivered even under a tree. So I would first address the human resource issue other than the infrastructure. I would consolidate these facilities, of course, with consultation with the area leadership and the public, so that they understand why we are consolidating facilities, at least if they are near each other. So I would consolidate facilities so that if this one person is not overworked, they will end up not doing anything anyway. So I would consolidate facilities and ensure that efficiency is observed. And in future, budget for the same facility that we have consolidated and ensure that we have staffed it. Again, another way we can take these opportunities through partners. There are very many partners who need workstations and offer services, free healthcare services. For example, partners like Cure International, who do treatment of clubfoot and orthopedic treatment. They can be given a facility to run concurrently with the county government as partner. That's how we'll address some of the issues. Thank you very much, Honorable Chair.
Thank you. Let me recognize the presence of our two honorable members. Honorable, please say your names.
Thank you, Honorable Chair. My name is Honorable Julius Songok, member representing Tuluet Ward and the Majority Whip.
Thank you, Chair. My name is Honorable Naomi Sorem, representing Gender and a friend to this committee.
Also, I'm a friend to this committee.
Thank you, members. Welcome. Feel welcome. Mr. Kapkea, you have something, and then I'll come to Honorable Chepkonga.
Thank you so much, Chair. Still referring to, this is the first time we are having two CEOs in this department. And I'm suspecting a lot of conflicts in the service delivery. So I wanted to know how you are going to handle that conflict. If there's a conflict in the service delivery between you and your colleague, how are you going to handle that conflict and any conflict in the department? And then secondly, you know, CEO, Chief Officer, is it is AIE older. Is it like that? That is so I want to know, what is your experience in managing and monitoring a budget? Because you are the one who is in charge of, you know, like any resource in the department. So what is your experience in managing a budget and even in monitoring that budget? And there's a question that Honorable Chair, you know, posted to you about the legal frameworks that govern. You had said that you will consult even the law. I want to know these laws that govern health sector in the Republic of Kenya. You know, these are devolved functions. So what are some of the laws that legal frameworks that govern these the health sector? Thank you.
National government policies. Sorry, let me give Mr. Chepkonga first, and then I'll come back to you.
Thank you so much, Chair. And Daktari, karibu, asante. Pongezi hadi mahali umefika sasa.
Asante.
Nimeona jina lako ni Daktari Paul Wangwe, Ongeti.
Yes.
Na pia wewe ni mwanachama, niseme mwanachama ama mwanaharakati wa UDA. Kwa furaha yangu, mimi ni member hapo. Nataka tu nijue huyu Daktari Paul Wangwe, sababu I'm trying to understand you. On the resume, you are what we call a jack of all trades. At some point you are a teacher. Nimeona unapata mshahara ya 4,500 mahali. Ukawa daktari wa meno, mpaka ukakuwa kiongozi wa sub-county. And then ikafika mahali ukawachana nayo, ukaanza yako.
which you have gone through it successfully for the past almost 5 years. That is 2017 to 2023. And then all of a sudden, you want to be a public officer again. What informed you to change? Because you, in your introduction, you said that you went public until you changed it to go to private. But now you have an intention of coming back to public. I want to know the motivation. That is number one. Number two, Daktari Paul Wangwe, who was born just 4 years ago, and I want to believe in the spirit of UDA, is a hustler. And within that very short time, he has amassed a net worth of 114 million. Paul, I just want to know. Can you tell us something about that? Because there is an active account we are seriously looking into as members of this house. One KCB account, Eldoret East branch. And you have, you are proposed to be a CEO, health. Could there be a monetary aspect that motivates you into this docket? So that, if I may ask on that alone, could you be a beneficiary of that account I'm saying? And then the last one is we have, and it's part of what our Honorable His Excellency Governor did by being the voice of the voiceless. You remember Bwana Koti Moja chose to hire ECD teachers on BNP terms. Would you advise the leadership to also consider employing the community health volunteers on P and P terms? Because you also recognize that they do valuable contribution towards the health interventions in this county. Thank you.
Mr. Chepkonga. Let me give opportunity our leader of majority, and then I'll come to Kebene.
Chair, thank you. Mine is a follow-up of one of the members who have asked. Daktari, you have seen that there's a lot of concerns around your working relationship if you are approved with your colleague, the CEO for preventative and promotive services. Now, my straight question on that line is, we know that the Chief Officer Health normally is the head of public service in that sector. He or she will be in charge of this, the human resource at that level. Now, between the two, who will be in charge of the nurses and all the workers in the department?
Thank you, leader of majority. Let me give opportunity Kebene.
Thank you, Chair. Daktari. Okay. As we all know, the Department of Health is the highest funded in the county. And it is in public domain that all cartels, both locally, within the county, and international, and also within the country, all cartels are hovering around the Department of Health. You, as the accounting officer, how are you going to handle the issue of cartels and balance the service to the people of Uasin Gishu?
Thank you, Honorable Kebene. Honorable Malamoch.
Asante mwenyekiti. Daktari, kuna swali niliuliza na sidhani nilipata jibu kamili. Hii swali ni private sector. Tumeona katika jiji letu la Eldoret, kila baada ya miezi mitatu hospitali inajipuka, na ni mahospitali kubwa kubwa. Hiyo ni kuonyesha upande wa afya katika kaunti yetu imedidimia kabisa. Na hapo umetuambia utafanya kazi pamoja na private. Sasa swali langu ni je, utasaidiaje wananchi wa Uasin Gishu, kwa kuwa wengi wameumia wakijaribu kutafuta matibabu kwa sababu hospitali zetu za serikali za kaunti zimeanguka. Sasa imewabidi wauze bidhaa zao, mali yao, shamba yao ili kutafuta matibabu. Ningependa sana kusikia na nijue kutoka kwako daktari kuwa utasaidia wananchi kuona kwamba wamepata matibabu kwa njia ya rahisi ya mahospitali yetu ya kaunti, kwa sababu itakuwa ni bure tukiweka pesa kwa sekta ya afya na ilhali tuna promote private sector. Sasa kutakuwa na haja gani tuweke pesa kwa idara ya afya, pesa mingi, na huku tunaona hatufanyii watu jinsi itakikanavyo? Asante mwenyekiti.
Asante sana Malamoch kwa swali hilo. Let me recognize the presence of Mheshimiwa Amos from Rescos Ward. Welcome, Amos.
Thank you,
yeah.
Chair.
Welcome, Mheshimiwa Yego, and then he will answer those questions, all of them. Sorry, not Mheshimiwa Yego, it's Mheshimiwa Songok, our whip. Welcome.
Thank you, Chair, for giving me this opportunity to also ask a question to the nominee, Daktari. My concern is on the service delivery, especially to our patients. We have various dispensaries that we've come up with in our wards here in Uasin Gishu, but my concern is here that in these facilities, our people, when they want to be examined, maybe now to the lab, they'll be sent now to a further facility to go and do the test, and then also to be sent back again to be to get the prescription of what is happening. So my concern is that what measures are we going to do to make our people not to travel and getting back, away, back again to get the prescription. In that sense, it is even better for that patient to go straight away to a bigger facility than to the dispensaries that we have already come up with. So I don't know what measures are you going to do to see that in every facility we get all the prescriptions right from the examination, even the treatment itself. So that is my big concern. Number two, also that we have now our big hospitals, let's say now our flagship, let's say the level 4s, which are almost now done. I don't know now what are you going to do again as an accounting officer to see that those big level 4 hospitals, how are we going to finish it, and also get the personnel, the full personnel in that particular facilities. Thank you, Honorable Chair.
Okay, thank you, members. Dr. Wangwe, please answer those questions. And members, remember we started late, and according to the time you were given to do the vetting, our time is almost over. So prepare maybe the last questions as he answers this. Thank you.
Thank you very much, Honorable Chair. If I may request that I answer the last two questions, and then now I go to chronological order. Is that allowed? No.
I want you to answer the question Mheshimiwa Kebene asked.
Okay.
There is a question from Mheshimiwa Malamoch.
Okay.
Then there is a question from Honorable Chief Whip, and also from our Leader of Majority. I think I've not forgotten another one.
Okay.
And there is a question that was started by Honorable Chepkonga.
Yes.
About the statement issue.
Thank you very much, Honorable Chair. To answer the first question, which was from Mheshimiwa Kapkea, the conflict between the two departments. We would first structure these departments by creating an organogram, job descriptions, where job descriptions for each person under each department, each personnel under each department are clearly stipulated. Also have an analysis of assets under each department, so that if it's, for example, an ambulance, it falls under which department, or if it is a desk, this desk, is it under preventive or is it under curative? That way there will be a clear outline in also processes. Apart from having an organogram and personnel, we should know that these are processes under which department. That one, when it's clearly outlined and done in terms of a policy, there can never be any interference. So I think since it's a new department, that is the first thing we should focus on. I hope I have finally answered, or I try again.
You can relate to what Leader of Majority raised. No, like in terms of human resource, you know, in terms of separation of duties.
Yeah.
So that
Yes.
At least
we have cadres that fall under the preventive and promotive, like public health officers, who have their job descriptions. Those ones, when we are formulating the organogram, they will be clearly assigned their roles. And we have, for example, a gynecologist or a physician who falls under curative. So this one will, or an orthopedic surgeon. So we will look at the infrastructure of the orthopedic surgeon, the processes of this treatment of this orthopedic surgeon, and the personnel. Maybe a theater, they will fall under curative. And this public health officer will look at his processes, his job description, and his infrastructure. Therefore, there cannot be any interference in any way. Then the other question was me being a chief officer, being an AIE holder, and whether I have had any experience in managing resources. I have managed departmental petty cash at Kakamega, Malava Sub-County Hospital and Matungu Sub-County Hospital efficiently and effectively. I have also managed funds in my private practice. So, and also planned for its growth. And it has grown tremendously in just a few years, in 7 years. So I believe that I have the capability. About the legal framework that I talked about, we have the County Government Health Act of 2012, spelling out the different facilities, the level 1, level 2, level 3, and level 4, and level 5, and what is under the county government and what is under the national government. Then Honorable Chepkonga asked a question about my net worth. Yes, that is my true net worth. I am an ambitious person, I must admit. I started doing small things for my upkeep when I was immediately after high school. That is how I found myself to be a teacher. And I had a whole year, 2 years to stay at home. So there is no point I could stay at home. Even the salary of 4,500 was not enough. It was just something to keep me busy and to serve the community. Since I had a knowledge in French, which I had an interest in when I was in high school, I decided to use my skill, my knowledge, to impact in a certain school in Elgonview, then called Blossom Primary School. That is how I became a teacher. That also answers how I appear to be a jack of all trades, because as I waited for my university education, I had to serve the community in a way. And health is a very high technical skill. I would not start at that time to be, so that's how I found myself. After high school, I did French at Alliance Française, and as I taught. And then when I finished, that's when I joined dentistry. Then, being a UDM member, it's a right for, I think voting is a right. So that's how it's a basic right. So I voted as a UDM member. I am adventurous about being a public officer and having access or linkage to a huge account. Money is not my motivation as a person. That is why I could work for a whole month to teach French. My transport to the school was more. My transport and lunch was more than my salary. But I still was enthusiastic about engaging with people, teaching students. About being a public officer, coming from private to public officer, it's just about service to humanity. Even in my private company, I have still practiced the same. At Aquadent, we treat persons with disability free of charge. That we have done for a year. We have done free dental treatment all across the county. We have done it in Bungoma. We have done it in Trans Nzoia as a company. Even in all private schools. I am sure if you are a parent in any of the private schools around Eldoret and the public schools, you have come across Aquadent's work in the past 5 years. So we have served in...
Dr.
Yes, please.
Did you give any services to a public school in
Yes,
Wasingishu?
yes, we did.
Like?
Wasingishu Primary, I think it's a public school. Mm-hmm. Yes. We have done that same service to churches. We have visited churches and done treatment at no cost. So that is what drives me as a person, and also that's what gives me satisfaction. Then about community health volunteers on PNP, putting them on PNP would of course be a good idea, because it would reduce, would follow the scheme of service, and if they are well skilled, it can really assist in also reducing recurrent expenditures. Answering Mheshimiwa Kebenei's question on health being the highest funded and how I would deal with cartels, being the accounting officer, I don't understand what the word cartel means, but as long as we follow the Public Procurement and Disposal Act, whoever the individual and the right procedure is followed, then I think there will be no questions and there will be no interference to service. Then the question on the private hospitals around. Of course, we would tire to elevate the local hospitals. But because it takes time, we would engage. What I meant by partnering is maybe having, for example, service contracts with the county government that bring down, that subsidizes for accessibility. For example, currently, the county government does not have an MRI machine, which is a necessity in diagnosis. Between now and the time we are able to acquire, we can partner with the private facilities and have service contracts where we request that private facility to charge at at subsidized costs so that the public can also access. We cannot lock them out, and yet a citizen needs an MRI machine. In fact, we will have come in to help increase access to healthcare. Again, coming up with policies that will segregate the public and the private. For example, distance. Okay, you can come up with a law and say that it's just an example that there is this. There is a law in the Pharmacy and Poisons Board where, for example, chemists should not be less than 200 meters, which has not been enforced. So, following, creating more policies and sticking to them. Then Honorable Member Songok's question on how I would if I may request that you repeat your question. That's why yes.
And thank you, through Honorable Chair. Daktari, I was asking whereby patients are referred to the next facility, maybe for the test, and then sent back again for the prescription now for the medication. That we find that our patients are really suffering out in. So my question was, what are you going to do now? Because those cases are really found at our grassroots levels.
Thank you very much for repeating the question, Honorable Songok. About the back and forth, first of all, it also refers to my earlier response that I could not cluster the facilities, the 138 facilities. It directly correlates with his question. We have to first cluster these facilities. We have a dispensary, a level 1, a level 2. All these they are in levels because of the services they provide. After we understand that, we do civic education so that a citizen doesn't expect to get a CT scan in a dispensary. Once we have done civic education and the public understands what is expected of them, we now post them on maybe service charters so that at the entrance of the hospital, there is a service charter. And now that we are in an era where majority of the people are literate, there is basic literacy, they will be able to know that this is the service I expect from this hospital. This will also reduce complaints. Civic education will reduce complaints from the public. Then also on managing the patient flow. Once we digitize the systems, the record system, you do not expect a patient to leave with a prescription outside because there is no prescription. The prescription is online and posted to the pharmacy. If the patient leaves with no prescription, it will be at the discretion of the patient to leave and go outside. Because if the hospital is well equipped and the pharmacy is next to where the clinical officer or the doctor has prescribed, and then there is digitization, the same drug will be posted to the pharmacy. And now this will not have any link outside. The digitization will also help in pilferage and managing of drugs so that there is enough drugs. There should be a link between the patient file from the point of registration to the point of dispensation of this drug, or the point of diagnosis or x-ray. So for example, if a patient is patient number 10, you can easily know where the missing link came in, okay? Because you are able to follow this patient from history taking, diagnosis, to either treatment or medication, surgical treatment or medication. So if the treatment stops anywhere and there is this digitization, this software will be able to tell us, for example, when it's generating the report at the end of the month, 50% of these patients did not complete the treatment. Then we go and address and look at the reasons why. We can, because the patient contacts are on the platform, we can do a survey and ask why this patient reached at a certain point and it wasn't clear what happened. So we can easily link all the departments, all the way from procurement, all the way from the point KEMSA delivers the drugs to the county, and follow, because most of these drugs have batch numbers. You can follow this paracetamol and know where this paracetamol went and who took this paracetamol, if we have clear patient records. Therefore, it will also cover the issue of pilferage. Yes.
Daktari, thank you so much. I'm left baffled here. The way you've talked about the digitalization,
yes,
of the health facilities. I think as you go there, I wish you well. As you go there, kindly fast track that digitalization.
Yes.
As we talk now, within this county of Osungishu, everything is still manual. Now, the issue of fast tracking a patient from point A to point Z, I think I'm waiting to see in the next 5 years if it will work. I wish you well.
Thank you, Honorable Kebene.
Through chair.
Thank you very much.
Let me give Honorable Kipchumba, he had something.
Thank
And
you
then
very
I'll
much.
come back to Kapkea.
Thank you very much, Chair. I have two quick questions. One is in respect to drugs. We have been losing so many drugs in this county, especially from the source and to the entity where they are supposed to be the recipient. So I need you to explain to me, how are you going to track this drug so that it reaches the person? Second, I'm very much glad on what you have said on service delivery, on motivation of members of staff. And I want to inquire, how are you going to handle the part of disciplinary issues? There are those who perform very well, but there are those who don't perform, who perform not up to the expectation. So I need you to explain to me properly on how you are going to deal with the issues of indiscipline. Thank you very much.
Thank you so much, Mheshimiwa Toroitich. Mheshimiwa Kapkea, and then I as we are winding up.
Thank you.
Maybe
Thank you so much, Chair. There's a question that was raised by Honorable Chepkwanga, but he has left. But you didn't answer that question, that within a span of 7 years or 6 years, leave alone 4,500. You said 4,500 it was not even enough for lunch and transport. Okay. But 114 within 6 years, that is equivalent to around 18 million per year. If it is genuine proceeds from your businesses, from a salary, that is around 18 million per year. And you are hustlers. At least if you know when you explain that, it will even inform me on how I will work so that within 6 years, I'll be having 114 million by 2027. There is also this question on complaints. There's a lot of complaints from the residents of Uasin Gishu when they go to an health center or a dispensary. You know, they raise a lot of complaints. And one of the approaches that we are using to get these complaints, it's only through suggestion box. And through suggestion box, it will not reach you. It will not reach your department so that you act on it. So what are some of your suggestions on how we can track or get these complaints from our residents, from dispensaries and health centers? Because that is where there's a lot of problems. And finally, you've given us from your reveries. There's even public health officer from World Bank. If we make a call to one of them, your suspicion, one of the strengths that they will tell us about you, if we make a call to one of them, you'll suspect that they will tell us, Dr. Paul Wangwe, one of the strengths is this. From your point, from them. Thank you.
Thank you, Honorable Member. Let me...
Just
okay,
to add on, yes.
Let me give Kebene to fertilize.
Yeah, to fertilize Honorable Kipchumba's point.
And then I'll come back to Honorable Kate.
Thank you, Madam Chair. Daktari, I think when we started, Madam Chair asked you how many facilities we have in the county. Then I think that didn't come out clear, and you said probably you will do it. You will know the number as you go to the department. Mheshimiwa Kipchumba asked about how are you going to handle the discipline of staff. As the team leader, I think as the team leader of the department, as you are preparing to answer the question, you should know in our departments, and especially the dispensary level 1, level 2 dispensary health centers, and probably the district hospital here, which is the county hospital, we have staff, and the major complaint that is usually there, and members here can testify, probably when you ask them outside there, is a lot of backbiting. And that is a very serious concern to members. All members, every day when they wake up, there's issues about backbiting from staff of health department. Even you, when I was talking about how are you going to handle the cartels, probably you say you don't know the cartels. Who are these people? At this point, maybe I can say you're naive, but the moment you go there, you will know who are these cartels. And some of the cartels sometimes are some of the staff from the department. So as you prepare to answer issues to do with discipline in the department, some of the things you also need to consider. How are you going to handle the issue of backbiting within the department and that issue of cartels? Or probably you will go there and you'll be baptized to be one of the cartels. I don't know. Time will tell.
Thank you, Honorable Kipchumba. Let me give Honorable Keitany and any other person who has a question so that we just come to an end because our time also has come to an end.
Chair, mine is not a question per se, but just adding on the proper reporting mechanisms, especially because largely as a county we shall be dealing with primary health care, meaning we shall be operating from the facilities in rural areas. I learned a bit recently that we have something called GRM, that is the grievances redress mechanism. That is a very complex word for an old mama somewhere in Karuna Meibeki, and that it's actually a booklet where complaints are recorded. So my question would be, who is the custodian of such a book? Because the same person who is being reported might be the custodian of the book. So I would like to know, what friendly ways are you going to communicate and ensure that a complaint in the rural hospital somewhere in those rural areas will reach your office for address and maybe further action? Thank you.
Okay, thank you, Chirono. Mheshimiwa David Keitany.
Thank you, Chair. As a friend of to this committee, I think I had many questions, but because of time, and I know you are only left with, in fact, you have some few minutes before we come here with my committee, and I think I will reduce my questions to one, and that one is on the issue of drugs. There's a plan to use drones in the Uasin Gishu County to supply these drugs to LD facilities. I don't know your take on this, because you have talked of digitalization of health facilities. I don't know if this is going to be one of them, and if in case it's going to be one of digitalization, is it going to save us something in terms of money, or maybe the issue of drugs? Maybe that one, Chair. I will leave that to to Chair, because I know I will not wait for that answer, because I want to go and prepare myself. Thank you.
Thank you so much. Last question from Honorable Malamoj, and then
Thank you, Chair.
Finalize.
Through you, Chair, Dr. Wangwe, you highlighted the challenges that is befalling the health sector in Uasin Gishu. That was HR, understaffing and low training, healthcare consumer, patients record and follow-up. For that, I think you gave the remedy for that. You say digitization, but the other two, you didn't give the remedy. So what are the mechanisms that you'll use to address these challenges?
I want Dr. Wangwe to answer those, and then I'll give my final, maybe, question or comments. Thank you.
Thank you very much, Honorable Chair. I would like to start by answering the first question on drugs and loss of drugs in the chain. Just as I said, how we would address this is through digitization, where people are individuals, just the same way as a chief officer, I will be charged as an individual. Individuals will be charged, and these drugs, the process of dispensing these drugs and distribution of these drugs will be tied to individuals and specific departments, where just as I account, others will account for the drugs. If we invoke a proper system, just like in a bank, if money is dispensed to you, the person who has cashed the money has a password. That is the same way we will do with these drugs. So once these drugs are in the facility and there is proper communication between the store and the facility, then these drugs are tied according to patient's records, patient registration, doctor diagnosis, because in case you have amoxicillin syrup, we know the treatment we know the indications for amoxicillin syrup. So if we do not have a patient who has no infection in the month of January, ending January, and we do a report, and we see that amoxicillin syrup has been dispensed, then definitely there will be an error and someone will be answerable. I hope I've answered. Then on disciplinary issues, there is a disciplinary committee that follows steps guided by the Public Service Act. A delegated role to the chief officer by the County Public Service Board is to carry out disciplinary measures. The first step is usually give a verbal warning. The supervisor will give a verbal warning, then a second verbal warning, then a written warning, and then as it progresses to a hearing, and then at that point a decision can be made depending on the severity of the matter. But of course, the staff will be given ample time to express themselves. Then about my net worth, I believe I'm a good strategic planner. In my business, I associate with professionals. I don't do it alone. I associate with professionals. I source for the highest level of expertise. And as a person, I'm also a good strategic planner. And I work hard. And how that has blown up is because Aquadent Company Limited is has very many. It has an array of services. Very many departments, almost 7 departments, but all of them that deal with teeth. That is why my idea has blown up. It is not the business. I think it's the idea. I can say in the departments in Aquadent, for example, we have a dental laboratory, which it is the only laboratory of such a kind in East Africa, where we do crowns, bridges, and teeth replacements. So we get work from East Africa. It's not only Uasin Gishu. So that explains how a company can grow. We train dental assistants. There is no public facility that trains dental assistants in the country. There is no accreditation facility. And that is how I would work again with the Ministry of Education to ensure that this accreditation is done even under TVET, because there is no such facility that trains specifically dental assistants. It's on-job training. It's not certified. That is something else we do at Aquadent. So apart from, those are the reasons why the company has grown. Then complaints. In the manifesto of the Nguzo Kumi manifesto that His Excellency the Governor put across, the Deputy Governor seconded that he will put a toll-free center where people can make calls. So we can do civic education and make sure that there is a specific department in this toll-free call center that deals with health. And this department, this committee will report directly to me. Okay? And I know most of these calls are recorded. So from time to time, I can also get and listen to the calls. Then, again about, I will answer about the GRM because they are related. Civic education, again, is mandatory. Then I can do frequent visits to these facilities. Of course, me and my counterpart, and random visits from these facilities from time to time, and pick views from the public as an individual. I will not rely on information. Of course, this may not be an everyday exercise, but I will pick views as an individual. Then again, use external auditors and surveyors, where we can procure a company that can do an independent survey on healthcare delivery in Uasin-Gishu. This will give us an unbiased approach to service delivery. Then, if you call any of my referees, since they may have much to say about me, but they will say that I am a go-getter. Yes. Then backbiting. The problem, I feel like in any organization, backbiting can start because first, job satisfaction, idleness, poor structures. So once you have structures in place, clear job descriptions in place, performance appraisals, people's focus will change from talking to working. Although there may be quite some resistance, but we must have to be firm and ensure that we stick to appraising staff, basing promotions on appraisals. Then training people on interpersonal relationships, workplace relationships, establishing, reducing verbal communication and putting written communication, because most of the challenges may arise because of verbal communication. So if it is at the workplace and there is any communication to be placed, this communication has to be written. Therefore, no backbiting will take place. And following, of course, protocol and the right channels. About the cartels, I feel like it's a matter of following principles and being firm on the cartels. Yes. Then on drugs, the idea of drones can be a good idea. It will reduce the issue of maintenance of vehicles to distribute drugs, expense on fuel to distribute the drugs. So it's a very good idea. Then on Honorable Member Malamoch's question on training, motivation of staff. Of course, there is a portion of the budget allocated to training, but if it may not be enough, there are partners who are willing to assist in training and motivation of this staff. For example, if you look at MTRH structure, there is Moi Teaching and Referral Hospital, Indiana University as a partner, USAID and AMPATH as a partner. We have staff who are seconded by MTRH to AMPATH. We can invoke the same thing so that our staff, we may not get all, but the few staff feel engaged and valuable in the county. That's just an example. Have I responded? Thank you.
Thank you, Dr. Wangwe. Members, allow me to do maybe 2 or 3 questions before we close this meeting. And members, we have not taken much time because health department is a wide department, and that is why even in our budget, we take the lion's share of the county. So if we take time in doing the interviews or the vetting, people should consider the volume of work that we have as a department. Finally, Dr. Wangwe, what strategies will you employ in providing leadership as a chief officer? If given this position, because we believe there is a recommendation we are going to make at the end of the exercise, as a leader, you will be required to make decisions. Yeah? Quote the word to make decisions. Because making of those decisions will give good results in your department. Somebody who makes decision, gives directions and gives a resolution to a problem. Not a watermelon person, make decision. And the responsible for the outcomes of your decisions you make. What will you consider when making any decision that affects your department and the county at large? Remember, the Department of Health is the heartbeat of all the operations. What are you going to do since you are the heartbeat of all the operations of the county? What are you going to do for us? Finally, so that you can answer all of them once, members, what are your prayers to this Honorable Committee of Health Department at the Assembly as you are going to be the Chief Officer of the department? We are going to have our recommendation after this vetting. So what is your prayer to these honorable members, 11 members of this committee, and other members that will make an approval? We are 44 members of this house. What is your prayer to this honorable house? Mr. Wangwe. And then finally, Mr. Kapkea. This is just not a question. I wish you will do some orientation to these youthful MCS, yeah, to do businesses the way you are doing and attain the end of 5 years or even 6 years. The way Kapkea was putting induction. I want you to take them for an induction on how to do businesses, because I saw you have a lot of networking, which I want you to apply in our county. And there is something you said that I want to add on the devolution. From your point of view, what do you think in the future of devolution in Kenya? What can you do to see that this devolution and devolved function is improved? Because we work very closely with the national government, and we as an assembly can help the national government with your ideas to improve in other sectors of health. Finally, Mr. Wangwe, you have been invited today to this honorable house through an invitation from the Constitution of Kenya, the standing orders of the county government of Uasin Gishu. And one day, one time, my prayer, I wish for you to get the position. You will be invited again to answer the same questions in terms of implementation. So be ready. The way you came in today, you're going to be coming always if things will not go the way we want. And also we'll be inviting you so that we can share what is good for Uasin Gishu County. Thank you.
Thank you very much, Honorable Chair, for the questions. The first question is about leadership. I am going to be accountable to the public and to all stakeholders. I am going to consult widely. I am going to employ judicious use of resources in the most efficient manner. I'm going to practice an open door policy. Secondly, in decision making, there has to be public participation in my decision making. And as a person, I believe that I am firm. I don't fumble with decisions. That's after consultation. Okay. And my decisions will be based on service delivery and guided by the law. My prayers to the committee is to give me a chance to serve the public and to make a positive difference. Then on devolution, I foresee, so far I believe that devolution has been a success. And it's getting better. So I foresee a situation where in future all citizens will be participating in fair and equitable distribution of resources. Services will be delivered efficiently, be it healthcare services, water, and any other. And people will live a better quality of life. Thanks, Honorable Chair.
Thank you so much, Daktari, for answering questions prepared and laid in this Honorable House. It is for the benefit of Uasin Gishu County Government through the leadership of Honorable His Excellency Jonathan B. If we get professionals to give service delivery to the people of Uasin Gishu, we are wishing you all the best as a committee. Open this opportunity, please serve the people of Uasin Gishu wholeheartedly. Health services, or any person like you as a doctor, being a doctor is a calling, because it is a department that is saving a life. So we want you to save that life in Uasin Gishu, if given this opportunity. Otherwise, I want to thank all the members. I want, sorry, no, we must eating since morning to vet our first. Going to do another one in the next few minutes. I want to welcome you for a cup of tea, just a short break before we go to the next chief officer of this department. Thank you so much, and may God bless you all.